News Now Weekend.
An American healthcare worker who might have been exposed to the Ebola virus is under observation in Omaha tonight. According to Nebraska Medicine, the person is not showing symptoms of Ebola at this time. The individual is working in the Democratic Republic of Congo when the potential exposure happened. Tonight, specialists continue to monitor their condition. The Ebola epidemic from 2014 to 2016 put UNMC and Nebraska Medicine in the spotlight as one of the major treatment centers in the world to treat these types of diseases. Good evening, I'm Megan Hahn. It was just a few years ago when doctors helped 3 people stricken with Ebola in the biocontainment unit at Nebraska Medicine. I spoke with one of the survivors about his battle against the deadly virus. Several years have now passed since the largest Ebola outbreak in history ravaged parts of Guinea, Liberia, and Sierra Leone. The virus claimed more than 11,000 lives. But tens of thousands of miles away, here in Nebraska, healthcare workers at Nebraska Medicine fought to save the lives of Americans exposed to the virus on the front lines.
It's no kind of lie to say that they probably saved my life.
Journalist Ashoka Mukpo was on assignment when he first noticed something was off.
I felt a little bit kind of under the weather and stuck a thermometer in my mouth, and the reading came out, I think it was like a 99-degree fever or something like that. If you run a fever of that temperature in an Ebola zone, it's pretty obvious what is happening. So, I quarantined myself.
Mukpo tested positive for Ebola and was brought back to the States for treatment at UNMC and Nebraska Medicine's biocontainment unit.
Almost like an airlock type of system where doctors would come in through one door, they would go through a disinfectant process, and then the next door would unlock before they got out. So there's no way someone who's in one of those rooms can possibly get out without the consent and authorization of the medical staff.
After 3 weeks in treatment, Mukpo was discharged, a survivor of one of the deadliest viruses, which launched an international public health crisis.
The emotion that I felt at that time was fear. I'd seen people who had gotten sick with the disease and the kind of things that it had done to them. So the main really thing I think you battle when you are sick with the virus is just keeping yourself feeling confident about your chances, not succumbing to fear or over dramatizing what's happening to you.
Now the virus is making a resurgence, this time in the Congo, where the death toll is rising to more than 300.